And so what kind of health challenges were you having that made you want to look at this?
Oh my goodness gracious! I had stage 4 kidney failure.
Wow.
Yeah, and they were going to put me on dialysis, and I'd rather die first, to be very truthful with you. So after the third stem cell shot, I had stage 3 instead of stage 4. So that made me feel just absolutely wonderful. And I was just there Monday of this week, and my lungs are perfect, she says.
Wow.
That made me feel like $10 million, I got to tell you that.
So how long ago did you have did you start stem cell therapy?
Early last year, and the last one was July 31st.
So that would be, maybe 6-8 months ago.
Yes,
in
correct.
that realm. And so you came in not for any particular pain that you were having, but just because you were having some organ failure.
Yes, correct.
And thought this might help me.
You never know.
Yeah.
Yeah, you never really know.
Yeah, because it's still, I guess, you might say experimental or investigative in these areas, saying, hey, there's been a lot of trials done on this.
I had nothing to lose.
But when you say I'd rather die than have dialysis,
That's exactly right. Yeah.
That means you did have nothing to lose.
Yeah, so I was very fortunate with my lungs. They went from, 54 to 75, whatever that is, I don't know. And they're in perfect shape now.
Were they considering transplants or anything for you?
Yeah, I went to Mayo, and I qualified for a heart transplant. I had 3 heart attacks, 3 strokes, and 3 ablations. So it's
You've been through that?
Yeah, and it's a miracle. I'm sitting
Wow,
here.
so I had no idea that you had these heart issues also.
Yes.
So you went to Mayo Clinic and then...
I qualified for the heart transplant, but I was too old. See, once you're over 65, they won't give you one. So they sent me to UCLA.
Mm-hmm.
In UCLA, I stayed a week there running all kinds of tests. And my ejection fraction was 19, which qualified me for a new heart. But after you see all the people laying there for hearts and just, you just don't feel right stealing a heart. When I felt, it just didn't feel right. So I just decided not to go for it.
Wow. So how's your heart function now? Has that changed at all?
Well, it's went up some since then. I have no idea why I'm sitting here talking to you, to be very truthful with you. It's just amazing. Mm-hmm. I can do almost anything I want to do now. I'm going to Europe for a couple of weeks next month.
So you said you're going to Europe now?
Yeah, we're going to go to Switzerland and then Germany and France for 2 weeks.
Now, would this have been possible for you, or would you have considered this prior to having...
Not in a million years.
Really?
Right. Yeah, not in a million years.
Wow.
And just everybody gives me their blessings, so,
Wow.
Yeah, it's just, let me tell you one other thing real quick. I did a testimonial for my heart doctor because it's just a miracle. I'm here, truthfully. It's just, the big thing, they don't understand it, but, all I can tell you is how I feel. I can't tell you any more than that.
Your heart doctor or your nephrologist, your kidney doctor?
My lung doctor.
Your lung doctor. So when you told them did you tell them you were going to have stem cell therapy?
No, I did not.
Oh, so you just went and had it and then came back. What are they saying?
Well, let me tell you what happened. I go to cardiac rehab down the street on 27th Avenue there. And I had just started that. I was going in Scottsdale because I live in Scottsdale. Anyway, I asked the head guy there, and I says, tell me about stem cells. He says, I'm really not qualified to do that. And I says, well, what do you think? He says, well, he had an 85-year-old guy in here a couple of months ago, and the doctor sent him to me. He was going to die. Mm-hmm. So 1 week of him, and he couldn't handle it anymore. So he went back to his doctor. His doctor said, go down to Tucson to see a stem cell doctor. Mm-hmm. And he had the stem cells, and in 2 months he was back doing everything.
Wow.
So it's kind of like a miracle for him, and that really sold me on it at that point. My goodness gracious.
Wow.
And I'm 77. I'm not, 85, but
right.
I feel good.
But and did you notice a change in your energy levels?
Yes, an awful lot. As you're at that age, you get some aches and pains, but
sure.
Really, I don't have any of that. I feel like I'm 50.
Wow.
Yeah, I hate to say it's just unbelieful.
Shouldn't hate to say it. You should be happy to say it, right?
Yeah, I am.
I mean, I'm sitting here almost like with a little bit in stunned silence because these are very dramatic things. It's not like, hey, my knee hurt and I repaired my knee. Yeah. You're talking about life-threatening systemic illness that that you're on a very bad track.
Yes, I wouldn't be here. I mean, truthfully, it's amazing that I'm here.
Wow. Wow.
So, and I got 10 kids, 35 grandchildren.
Wow.
15 great-grandchildren, just to give you an example, you know.
15 great-grandchildren?
Yes, I do, yes.
Wow.
Amazing.
And now you're going to Europe.
Yes, going to Europe, right. So I'm pretty happy about it. My energy level has just, it's been unbelievable. I can't, you know, before I had a very difficult time getting out of bed. I'd have to grab the post and pull myself out.
Psychologically, were you getting depressed?
Well, I think you have to.
Yeah.
You know, you have to get depressed. I mean, what are you going to do? My wife died 3 years ago, and
I'm sorry.
I was living by myself with my little dog, and you have to get depressed. There's no, how else can you get?
Yeah.
You know, but now I can do anything I want to do, truthfully.
Wow.
So I'm pretty happy guy right now.
Do you go back to your friend and say, hey, thanks for taking me to lunch?
Yeah, he's a good guy, and he just thought it would work, and he's trying to get enough money together to do it also, so give you an idea.
Yeah, so that's just terrific. Well,
and I sent 2 of my buddies down from Carmel, California, and they both flew down here, and they had all the stem cell treatments here, and you know, one guy had 5 heart attacks.
Wow.
That's unbelievable in itself.
Wow.
You know, and one day he's 69 and Fred's 73, I think.
Mm-hmm.
You know, just to give you an example. So the 73, I took him to lunch, and Fred says, Fred, what are you doing now? Well, my wife died a couple of years ago, so I just quit everything, decided just to, he says, and this was his last shot, by the way, and he says, now I started building again. I says, what do you do? He says, I build everything. I says, you got a lot of work going. He says, I got $380 million worth of work on right now.
Wow.
From saying, I would never know that. You know, how would you ever think about that? My God.
So he went from basically, you know, giving up,
he's depressed,
saying I'm pretty much done.
Depressed and everything, and he had a hard time breathing and everything, and you know, and
he's got $380 million in projects development right now building.
I don't know if anybody else has that, so.
Wow.
That's just amazing to me.
So, and because this is always the curious thing, because, you know, I come here and we're doing this documentary, and I know that when I'm asking, you know, centers to put together some patients we can interview, I know we're just interviewing a fraction of the patients from the center, so I never know, you know, how pervasive these kinds of results are. But now when I can talk to you, and you're referring friends, so I'm saying, hey, are your friends seeing results kind of like you did, or you know, what's their experience?
The 9th largest car dealer in the world called me a couple weeks ago. He says, Ted, can I have this stem cell doctor? And I told him it was Dr. Travis. Mm-hmm. And I says, well, what's up? He says, after seeing you the last 3 months, he said, I got to go get it done.
Wow.
So he's going to get done at Palm Beach. But
wow.
It's those kind of things that are just amazing. I'm not young anymore, you know.
Well, you certainly, I mean, you're sitting here, you seem you're pretty energetic. And
I used to have to sleep for a couple hours every afternoon. Now I don't have to.
Wow.
That's amazing.
It is amazing. Mm-hmm. It is amazing. Any last thoughts or things you'd like to share?
Well, the big thing, what they said to me, it doesn't cure dead tissue. Mm-hmm. So the bottom of my heart's dead. It's not going to make it new. It's that simple. But it'll help everything else. Mm-hmm. And to me, it has helped everything else. So I don't know what else to say.
Well, I think you said it all.
Yeah, I think I have to.
It's really impressive, and I appreciate the fact that you took your time to come in here and share this.
I tell everybody.
Yeah.
So it's not a secret. Everybody knows me.
Yeah.
You can't believe it. So I'm kind of a happy-go-lucky guy right now.
Well, Ted, it shows, and your enthusiasm for it is for good reason, well-founded. Yeah. And thank you very much for taking your time to come and share it.
Anytime you need me, call me. Just tell the truth. That's all I can do.